Hi, good evening, everyone. Today we'll be looking at a very interesting course in community health sciences. That is um, community participation. So I urge you to be attentive and to follow up with these lectures. Okay. So today we'll be looking at what community participation is all about. I'm Ezra Ronyeka. Community participation is a crucial aspect of public health programs as it ensures that interventions are effective, sustainable, and culturally appropriate. Community participation is all about how the community now gets involved in their own affairs, in all that concerns their own health. Okay, that's what community participation. They now participate actively in seeking solutions to some of their health needs and challenges. Okay, so community participation is a crucial aspect in public health programs and community health programs as it ensures that interventions are effective, sustainable, and culturally appropriate. Steps involved in community participation. One, you will have to identify the health status of the community. You will have to conduct a thorough assessment of the community's health status. That is the community level. At what level can you say this community is when it comes to health? Are they low, high? So you have to conduct a thorough assessment of the community's health status by gathering data on what prevalent health issues, disease burden, healthcare access, socioeconomic factors. You will have to gather all these factors by conducting a thorough assessment. When you have gathered all this information, what type of disease they suffer? Do they suffer malaria? Do they suffer typhoid? Is more of hypertension and diabetes? Is it more of accidents? Are they epidemic prone? And what is the disease burden? What is the prevalence of a particular diseases? What is the prevalence of particular diseases in that community? What is the incidence? So all this will help inform you whether they have a high disease burden. Okay, then you also have to make assessment to determine if they have easy access to healthcare. Where is the health center located? How many hospitals are linked to the hospital? I mean, how many hospitals are linked to the health center? Then that health center, is it within where these people live or is it far away from them? Then thirdly, you look at, is there a good road to the health center and to the hospital? You also look at socioeconomic factors. What is the poverty level? What is the poverty profile? Are they rich? Do they have access to socioeconomic activities? What type of food do they consume? All this will help you and give you an insight and also inform you the level of health status in the community. So you will have to first of all identify the health status of the community. So you will have to engage with the community members, local health workers. When we mean local health workers, that's health workers that are resident in that community. You can find the JHUs, Junior Community Extension Workers, in the Nigerian context. You can find the community extension workers, the community officers, the doctors, the resident doctors, the community midwives, and environmental health officers that are local, like resident in that local area. Then we'll have to also engage with the stakeholders to understand their perspectives on health challenges and priorities. So by the time you have discussed with them, you will now understand their own view about the level of health that is in that community and what is their priority. Okay? Then the next step is you inform the community about the program and determine their level of participation through community mobilization. You can only know if the community will participate when you have invited them for a program and they were able to show up. Okay, when you invite them for a program and they were able to show up, then you can say largely that this community is what this community have high participation. So you have to inform the community about the program and determine their level of participation through community mobilization. We will discuss community mobilization in another lecture. Communicate the goals, because this program you're about to bring now, after you have carried out a thorough assessment of the community, you have checked all these factors, diseases that are prevalent, disease burden, healthcare access, socioeconomic factors. You now, and then you now engage with their stakeholders and community members. You have come up with something that this is their present problem. Then you stay with other colleagues, design the goals and objective of and benefit of a program that you will introduce to help in that community. And in a way, it will be presented in a sensitive way. Let's say it's a particular custom that they are practicing that is the leading cause of a particular disease. Like one of the stories about smallpox in Lagos, when they were the group of people were worshiping the god, and they thought that the god was to heal the smallpox, but they know, unknown to them, that that was the source of the spread of that disease. Before the legend doctor had took the risk of joining the court, Sapuna, in order to identify and educate them, you see, in a culturally sensitive way. So now you will have to inform the community about the program and determine their level of participation through community mobilization. So communicate the goals, objectives, and benefits of the program to the community in a clear and culturally sensitive manner. You will now have to mobilize community members through various channels, such as community meetings, door-to-door visits, social media. Now we have social media, Facebook, WhatsApp. You can have the PG on WhatsApp, and the PG may also have a WhatsApp group where the youth leader, some of the executive are there, and in that of the youth people, they also have their own WhatsApp platform. So from your own platform, you add the PG. The PG will now send information to the youth, and the youth will share to the woman. So social media is very, very effective now. The social media and local influencers. There are persons in the community that when they talk, the community will listen to them. You have to also engage these people, okay? Then you can also engage in door-to-door visits, explaining the essence of that program. It could be on hand hygiene, okay? It could be that by the time you did the assessment at this level, you find out that it's because they have poor hand hygiene, that is the cause of diarrhea they have in that community. Then you come up with the objective to reduce the diarrhea by 50%. Then how can you do that? It's a true campaign. That's the strategy you chose. And then you have to communicate these goals and benefits. You tell them that when they begin to wash their hands, so disease conditions will no longer occur among them. So by the time you have come up with this, you have to mobilize the community. You have to mobilize the community through channels such as community meetings, that is mobilization, through meetings, door-to-door visits. You have to engage. You have to engage other hands to help you to carry out door-to-door visits. And also use social media, like we explained, and also local influencers. Then you assess the willingness to, well, by the time you are engaging in this, you now assess the willingness of the community and the capacity they have to participate in the program. And now you tailor engagement strategies accordingly. By the time you are going about trying to influence them through community mobilization actions and activities, you now know if after they are willing to listen to you or to follow. And if they are willing, you now identify what capacity they have. What is capacity and what are they vulnerable to? The capacity is what they have and which they can use to help themselves. It could be they have an influential son who is in the government house, so he can invite the governor or can get government backup. It could be that they have youths who have powers, who can dug a good borehole, who can, or they have children that are doing well in business, who can actually bring up funds to support the campaign. Okay, it could also be that they have pastors that are being listened to. These are capacity of that community. So you are to assess their community willingness and capacity to participate in the program. Okay, remember we are looking at steps involved in community participation. And we believe that first, identify the health status of the community, which we'll explain. Now we'll say inform the community about the program and determine their level of participation through community mobilization, which I've looked. The next step is ensure that the programs are socially and culturally acceptable. If it goes against the culture of the people, they will not accept it. It could be maybe in a particular community, they don't eat snail, fine. And they're denying those children. And there are a lot of this community don't have access to goods, money for fish and meat. Trying to tell them that eating snail is good, it will be a serious issue to them. They will see you as someone that's against their custom. So you have to find a way. You have to find a way to align with them while you try to open up their eye. Okay? So now, adapt your program strategies, messages, and interventions to align with the community's cultural norms, beliefs, and practices. It could be that they're doing female circumcision. First, you agree with them. Then by the time you have entered them, you can now use a video of a woman who have been circumcised and she's undergoing labor. And they'll use their eye and see in that video how the tears, the scars of the cut could not allow the vulva to dilate, and which probably led to the death of the child or the woman bleeding after birth. With that, they will be informed and understand you. But going straight forward to criticize it, you might be putting yourself at danger and rejection. Then involve community leaders, elders, and influencers in decision-making process to ensure culturally sensitivity and acceptance. They always would look up to their leaders. So you must involve them. Anything that did not support you will not go well. Okay? Address any potential barriers or challenges related to cultural belief or practice that may impact the program implementation. So now you see what I explained. So using that example I cited, by the time they watch the video, they would understand and give you their support. Okay? Then obtain their consent for approval in time. Seek formal approval and consent from the community leaders, their representatives, and members before initiating the program. Yes, you have to agree with them that in 2 weeks' time, we are going to start this program. Okay? You agree with them with time so that they will come. Not that day, they will go to their different business. Clearly outline the roles, responsibilities, and expectations of both the community and program implementers to establish mutual understanding and trust. You will have to share some certain roles for them, okay, so that they will be actively involved. The next step is involve them at the planning stage, one, implementation stage, and also at evaluation of the program. Let's say it is in the campaign for hand washing, you have to involve their local guide. So the local guide will be the person that will spearhead it, showing you the shortest terrains to follow in order to reach out to the vulnerable population. So by the time you involve them in the planning, look at what you are going to do. This particular approach is usually followed during immunization. You have to involve the local announcers from the community. So they will be in the planning stage. At this associate day, we are going to announce to Umwekwe community. Associate, we are going to announce to Umuzi community. They are involved in the plan. Also, in the implementation day, during the immunization days, they also follow you in the team to give those children those vaccines. That is involving them at the planning stage, implementation stage, and evaluation stage. At the evaluation stage, that is when we're trying to evaluate the effectiveness of the program, you're also going to involve them so that they will understand and know this is actually for their own good. Engage community members in the planning process to co-create strategies, set goals, develop action plans that reflect their needs and priorities. Encourage active participation of community members in the program implementation by assigning them roles, responsibility, and tasks based on their strengths and interests. You see what I explained earlier. Conduct regular feedback sections, community meetings, and evaluations to assess the impact and effectiveness of the program in addressing the identified health problems. In immunization, we call it evening review meeting. At the evening review meeting at the LGA level, at what level. The OIC will talk with the teams. How far? What did we see in the field? Were there rejection? Were there AEFI cases? This is regular what? Evaluation, so that they will be following up. Collaborate with community members to identify areas for improvement, sustainability measures, and future interventions based on the program outcome. So maybe let's say in the field, they encountered rejection from a particular school. Because they have their members there, they will say, okay, because there's need to vaccinate these children, so they don't come down with this disease condition. They themselves, the owners of the community, they will now go and meet with the owner of the school. So you will see that the community will accept, and those children would now be what? Immunized. So that's the second third step, okay, involving them at the planning stage through implementation and evaluation what stages. Then let's look at the advantages of community participation. Community participation in health initiative offers numerous advantages that contribute to the overall well-being and development of a community. First, it ensures effective supervision over health. When communities or community members actively participate in the health program, they gain a sense of ownership and responsibility for their well-being. This leads to the better monitoring and supervision of health services, ensuring that they are tailored to the specific need of the community. Let's still use that immunization. When one of the members of the team, local guides, maybe supervisor or recorder is from the community, he knows that this is a QMS compound and he has 5 children. So if those children were not immunized, maybe by another thing, they will identify and bring it up in subsequent that a KMS family, their children are not what? Vaccinated. And this will aid what? Supervision. And because he has understood the importance of the immunization, he will be pressing hard that so that every children of that community would get the vaccination. Then the next advantage is that achievement of felt and real needs. Community participation helps in identifying and addressing both the perceived and actual health need of the community. By involving community members in decision-making process, health programs can be more responsive and relevant to the community requirements. Because during the planning stage, they are there and they are listening. We want to share Metizan. Now, you must have told them about what Metizan prevents. And in that community, maybe most of the elderly person and the women complain of ETI, maybe due to filarial worms or ochroichiasis. So then that's actually this is a problem we are suffering. You will see that this is their real need. So by sharing that drug now, ivermectin, they will accept it and take it because that eye itching that everyone is always complaining is one of their felt needs and which needs to be solved. So that's one of the advantages of community participation. They will now be the one that will tell the people in the community that accept this so, and inside the team that is sharing that drug, mostly are from the community. They will know it's for their own good and it's not to harm them. The next is utilization of labor force. That's another advantage of community participation. What this is trying to explain is that engaging community members in the health projects, such as building facilities like toilet and water supply systems, not only reduces costs, but also foster a sense of unity and collaboration with the community. This shared effort leads to creation of sustainable health infrastructure. By the time they are involved in the planning stage, maybe for that sharing of Metizan, you see, women will volunteer themselves to be the one that will go about and share it. And they will make sure that the drugs get to the rightful families. You see, they will make sure without hoarding it or being stolen. Let's say it's toilet that is about to be built for them. The youth might volunteer to dig the ground for the toilet. And when they have contributed their energy in establishing that facility, that toilet, they will protect it. They won't allow it to be messed around or to be vandalized. That is the utilization of labor force. The next is enhanced developmental effort. Community participation contributes to the overall development of the community by fostering a sense of empowerment and collective actions. When individuals come together to address health challenges, it often leads to broader community development initiative beyond just health. So when they are coming, I see a lot of ideas will be flowing, and a sense of commitment will come up. And you see some of them are in the community. They have powers in the government. From there now, they can say, okay, I will talk to my NGO, I will talk with my organization, I will talk with my boss, that since we don't have our source of problem is born water, we're going to do something about it. And the advantage is that it increases health awareness. Yes, the people now, they'll now know, oh, this thing that's eating my eye is a set of worm that came from the water I drank or came from the fly that bit me. Or it's because, that this diarrhea that my child is having is because we are not maintaining appropriate or adequate hand hygiene. You see, they are what? Learning. And this will enhance their health-seeking behaviors. The health-seeking behavior is just the attitude towards seeking for health when you are sick and when you are not, when you are healthy. The approaches you take to maintain health, or the approaches you take when you feel that you're not healthy, that just health-seeking behavior. So when they are actively involved or when they are participating in the health program, they tend to learn more. They tend to understand and they tend to know. Like in the immunization sectors, mothers are taught what each vaccines do in the body. And this helps them to know more and to value what is being given to them. Another advantage is that there's improved health service coverage. Community participations help in expanding the reach and coverage of health services. When community members are involved in planning and implementing health programs, services can be delivered more effectively to those who need them the most, leading to improved access to health for all members of the community. You see, you are the true serving that community. They know who suffers who suffers what, at what time. So by the time you involve them, they know, Ike Emeze's family need this drug, and they will go there. Even after the work must have come and gone. They always go back to check if actually they received that care. So that's one of the importance of involving community participation. The next is constraints to community participation. What are the challenges? What are the hindrances that you might likely encounter in community participation? One, non-consultation of the community leaders. If you don't consult with the community leaders, you are most likely to have issues with them because they will not listen to you. They will not listen to you. But if you engage their king and their king talk to them, they will definitely listen to you and give you every support that you would need to ensure that that program comes to fruition. Another constraint could be health services or program offending the people's culture. That is where you have to be sensitive enough. Okay? Even though that maybe the culture is wrong, you have to find a way to convince them first. Convince them first before trying to castigate the other cultures. And you must do it in a sensible way so that you don't lose the trust you have already gained from them. The next is, another constraint is coincidence of program with potential festival day or market days. That is why, from experience, if you go for supervision during the days that a particular community have their markets, for this, you want to go supervision for immunization activity. So you are most likely going to have issues if your program have coincidence with their festival day or market day. So that's why when they are involved in the planning stage, you say, on the Nko day, on the 14th of March, we are going to have our New Yam Festival. So you shift the program. The next constraint is power towards in the community. When the community are having power towards, the program might clash because if you meet the wrong one, or if you meet the opposite one, the opposite have its own section, or his followers, they will try to counter it and lead it to destruction. So community, and whenever there is power tussle, programs may not really work as planned. The next is political factors. When we say political factor, it's also hard to do with issue of leadership, where there are a lot of political affiliation. Let's say you, the health worker that is initiating the program, you are a member of a particular party. They say you are an AA member, and the king, who is the community leader, is PDP. You are most likely going to have issues because it will be seen as politics. Maybe you are coming to campaign, or maybe you are planning to plan the program, or the program came up when there is campaign for election. Okay, and you came with the program, and you've been someone that have been known to be a full fan of APC. And inside the community, that members who are PDP, they will see that you only came for campaigning, not to win the hearts of the people, and that will be an issue. Or the leader you met, who is the leader you met, maybe that the leader is an APC member. Members who are PDP will try to show some objection. So that's political factors having effect. Okay. The next is lack of funds to execute the program. Yes, you may actually plan the program and all things going well, but there's no fund to gather the IEC materials and all of that required for the campaign. It will not hold. Then communication gap between health workers and community members. Let's say you are dealing with a community that is different, and you are not from there to speak their local language. You might likely going to have an issue, because I encountered that during my community days, community experience. I wasn't hearing I was not actually understanding, sorry, what the patients were actually complaining, because they were using their own local language and they cannot communicate with English. So you require what, a translator or an interpreter who would help you to make it easier. So what are the facilitators of community participation? We have one, time lag of the project. When the result of a health intervention are visibly quickly, community members are more likely to be motivated to participate. Seeing the tangible outcome sooner rather than later reinforces the value of the involvement and encourage continued engagement. Let's say that's why you have to prioritize to gain their trust. Because people like to, what you do that immediately, they see and nah. Let's say a child has been, you are carrying out a campaign on hand washing and use of ORT to combat diarrhea. I am not playing enough. There's a child who was actually passing diarrhea, or the family, the community was actually facing that case that period. And after you're teaching a campaign, they went and did it, and the diarrhea stopped. You have earned their trust, and this will solidify their community participation. The next is involvement of community members in decision making and planning through implementation. We've said it. When you do this, they will feel the sense of ownership, and they will be empowered, and they will protect it, and they will participate. The next is it leads to knowledge of the necessity of the project. Yes, the community members who have participated will now understand the essence of the project and the importance of that project or that program. And they will know how the funds were spent, the transparency, the information, and they are built. This will enhance their participation for further programs. The project not offending the culture of the people. Yes, once the project is not offending the culture of the people, they are likely going to accept it. Projects meeting the felt needs of the community. I've said it. Once the once the project or program meets what the people feel that's their problem, they are likely going to participate more. Okay, so that is all about community participation. So in this lecture, we've been able to look at what is community participation, which is available to in the community health sciences and public health programs, which is necessary to achieve acceptance and success of the program. And we looked at various steps. We looked at one, identify the health status of the community. We also look at inform the community about the program and determine the level of participation through community mobilization. Then we look at under steps and ensure that the program are socially and culturally acceptable. Then went forward to look at obtain their consent for approval in time for that program so that it doesn't clash with any of the program or culture-related issues. Then we went forward to talk about involve them at the planning stage through implementation to evaluation. Then we'll wrap it up by looking at the advantages of community participation. Now we said it ensures effective supervision of overhealth. It helps to achieve felt and real need. It utilizes the labor force. It also enhances developmental efforts. It increases health awareness among the participants. It improves health service coverage. And we looked at the constraints to community participation. I would say non-consultation with the community that will lead the program to crash. Health services or programs offending the people's culture. Then coincidence of the program with the important festival days or market days. We also looked at power tussle in the community. Political factors, lack of funds to execute the program, communication gap between health workers and community members. And what forward to look at of community participation. We look at time lag of the project, involvement of community members in decision making, knowledge of the necessity of the project, program and project not offending the culture of the people, program and project meeting the felt need of the community. And this, we said, we are the facilitators for that enhances or facilitates at least 90% or 80% of community participation in any health program. Okay, so that is all about community participation. Thank you, and I urge you to look up for the next lecture on community involvement, community diagnosis, and mobilization. Thank you very much.